Hey guys, welcome back to my channel and welcome back to another video. So before we begin, I just want to point out I don't expect this video to be very long at all really. It's more of an update from a previous video that I've recently uploaded. So a little bit of background then. I posted a pregnancy update. I will link it down below. I'll pop it up on a card. I can never remember what side it is, but I posted a pregnancy update a little while ago. I can't remember how many weeks it was, maybe it was my 32 week video, but within that video I mentioned that I had been having some bigger scans or like growth scans. The baby was measuring a bit bigger and I had high waters, and the midwife suggested that we went for a gestational diabetes test. At the point of filming I still didn't have the results back, so I'm following on from that video and obviously explaining a little bit about what has gone on since then. Guys, if you do enjoy the video, please give it a big thumbs up, subscribe to my channel. I'd love to have you as a viewer, and without further ado, let's get into today's video. Okay, so as the title probably already suggests and already what I've spoken about, it's probably pretty clear then that my results for gestational diabetes, they came back positive. So that's positive for gestational diabetes. I thought what I would quickly do throughout this video, I had no idea what gestational diabetes really was. I knew it was something that you got in pregnancy, but I didn't really know too much about it. So I thought I would do a bit of a brief explanation as to what this is. Just want to point out, I am no medical expert. This is not medical advice. Some of the stuff I say may even be wrong. I'm just going from what the midwives have told me and the research that I've done online. I'm going to link some sites down below for some really good places that I've visited over the last couple of weeks since finding out that I have diabetes. So if you want to go and check those out, if you're going through something similar, there's some really good sites down below that you may want to check out. But I thought I would just maybe give you like a bit of an update as to some of the warning signs that the midwife saw, but then also kind of a bit of background as to what it is, how it's managed, how I'm coping with it, etc. So before we sort of go into what it is then, I had a few sort of scans because I hadn't felt baby move in a little while. I went up to triage one day. They referred me for a reduced movement scan, and baby was measuring on the higher side, his tummy. But they weren't sort of too concerned about it. Baby plotted normally, or they thought he plotted normally on the graph. They weren't too concerned. Went to one of my routine midwife appointments and they started measuring my tummy at that appointment. And he was measuring way above any of the percentile lines. He was measuring really, really high. And she said, look, let's just leave it. There could be discrepancies with measurements. He might be in a funny position. We'll leave it. I'll see you in 2 weeks rather than 4, and we will measure again and see where we are from there. So I went back then 2 weeks later. Again, she measured me, and surprise, surprise, he was measuring again quite a bit bigger. And he was going up on like a nice scale, but it was bigger than what he should be at the moment. So she quite urgently referred me then for a growth scan, which I managed to get the following day. There was a cancellation, so they called me and managed to squeeze me in. As I was having the scan then, he was measuring, I know this is only an estimated weight, things obviously change, but he was coming in at around 4 pounds 6 ounces. And this was at like 29, 30 weeks, I believe. And I had a high amount of waters, and his tummy was the thing that was measuring a lot bigger. So when I went round to the midwife station, because once you have like a growth scan, you take your results to the midwives and they plot it on your graph in your notes for you. So that way then you can see like the escalation of baby growing. And she looked really concerned and she said, have you been referred for a gestational diabetes test yet? And I said, no. I didn't have any of like the risk factors, as they call it, to even warrant having a test. But obviously the combination of big baby and high waters, it could be a sign of gestational diabetes. So she said, we need to get you tested ASAP, because if it is that, then we need to get you treated and looked after. So she took me around to the blood test room. They booked me in for the following day, had the test. The results took quite a bit of time to come back. And then I had a call from the midwife about a week or so ago now, confirming that I do have gestational diabetes and that she would refer me to the diabetes and pregnancy team, who I now have seen. They've been great. They've been so lovely. They've guided me through the last week. They've explained to me exactly what gestational diabetes is, how it's going to be managed, what it means in terms of pregnancy going forward, potential labour, etc. So yeah, that's been great. And I thought I would just maybe sort of update you as to how I found out and kind of what it is and what I've been doing really to try and make some changes in my life when it comes to managing my blood sugars. So if you don't really know then what gestational diabetes is, effectively it is high blood sugar or glucose within pregnancy. And it usually disappears pretty much after you've given birth to baby. She said it's normally formed within like the second or the third trimester, but it is normally picked up in the third trimester, obviously when you start having measurements, growth scans, etc., because that's sometimes when, if you don't have any of like the risk factors, that's when like the warning signs can come about, such as the high waters and baby having a little bit of a bigger tummy. So I keep mentioning them like risk factors of gestational diabetes. I believe at the beginning of when you have like your booking in appointments or like your 12-week appointments, they ask you obviously some questions about things like BMI, your family history, your like ethnicity, if you've had babies in the past and how much maybe they've weighed, and whether you've had yourself diabetes or pre-diabetes or gestational diabetes in a previously pregnancy. I believe those kind of things are what they call risk factors for getting gestational diabetes in pregnancy, and I didn't have any of them, so it didn't warrant me getting a test. A few people I know are currently pregnant, they've had the gestational diabetes test and it came back completely clear, they were fine. So obviously mine was just picked up through baby having a larger tummy and obviously high waters. I was convinced that it was a me problem and it was me that had caused this, and I went through quite a bit of stress and upset about a week or so ago for a few days, because I was so convinced that it was something that I've done to myself and that I've done wrong, because obviously with pregnancy comes cravings, and my cravings have been sweeter things. I've been eating a few cakes, so I thought that was my fault, but it turns out it's more just about that the body can't produce a hormone to keep up with the rising blood sugars during pregnancy, and then obviously in return of that it makes the baby produce more insulin. So turns out it's not anything I've done, anyone can be at risk for it. I did come clean with my diabetic midwife and admit to her about my cravings, and she reassured me and said it wasn't anything then that I have actually done. So the test itself then, because I was going to sort of say about any symptoms then that I would have maybe have had apart from obviously the ones with baby. Obviously the symptoms of high blood sugar are increased thirst, increased urination, dry mouth, increased tiredness, and I kind of had those things. Obviously I'm tired all the time anyway, I've got pregnancy anemia and I have a toddler, so I am knackered all the time anyway. And I have actually been drinking a lot. I constantly have a water bottle with me, have one down here right now, but I can't stop drinking water, and I notice I have been peeing more at night, although all those things are common and normal in pregnancy anyway, so it wasn't even a part of me that thought, oh, I probably have gestational diabetes, I'll mention it to the midwife, because, you know, increased urination, increased thirst, and especially tiredness, they are just normal things in pregnancy. So it was only obviously having that test then that revealed that my blood sugars were high. So the test was really simple and straightforward. Effectively, the test that they did is that they pricked my finger and took my blood sugar reading, and that was fine. And then they did a blood test. After the blood test, I had to drink a really sugary glucose drink and then wait for 2 hours. And then after that 2 hours, they then took a further blood sample, sent both off. And then obviously when they come back, they can see whether my body was able to, you know, break down that extra glucose I had been given, or whether it just kind of stayed in my body and I wasn't able to sort of break that down. So blood sugars tend to be anywhere in the range between sort of 4 and maybe like 7.5 is classed as like normal. So I think before the blood test I'd been fasting, so it came around 4, so on the lower end, but still, you know, in the normal limits. And then after the glucose drink, it came in at 9.2, so quite high. So that is definitely a positive there for diabetes. I feel like I know quite a lot about diabetes anyway, because my partner is a type 1 diabetic. Obviously they are very, very different. He goes through a lot worse than I ever do, and the more thing I was sad about with the gestational diabetes was how it was going to affect baby and potentially my labour. The diabetes itself I'm not worried about, because I've looked after my partner for, you know, the last 10 years and watched him go through something really difficult and that he lives with every day and will never be healed from. So I'm quite clued up when it comes to like blood sugars, what I can eat, how it's managed, that kind of thing. But within pregnancy, it is a little bit different because it's not really about it affecting me as much. It's more about it affecting the baby and the baby's growth and how much insulin the baby's producing. So some of the levels are slightly different for pregnancy. So I've been blood testing, finger prick testing, and checking my blood glucose now for the last, I think it's 4 days now, 5 days, whenever they managed to get me in at the diabetic clinic. So effectively, they need me to be testing my blood before a meal, and it needs to be below 5.3, and then test again an hour after I have had a meal, and it needs to be below 7.8 ideally. So it's a much sort of smaller range when it comes to gestational diabetes than it is with like type 1 or type 2 diabetes. So it's a lot more strict. I'm managing all in this little book. I've got a lovely blood tester. Don't worry if you're afraid of needles, won't be showing you any kind of needles in here at all. But effectively, I've just got like a little meter, some like strips, like a finger prick tester, and quite handy with my partner being a type 1 diabetic is before he's on like a pump system now, it's very technical, but before he moved on to that, we bought loads of these blood glucose meters that are called Freestyle Libras, and they are effectively a sensor that you inject onto your arm and it will tell you what your bloods are. I don't know if you're going to be able to see it, hang on. So I don't know how well you can see that, but that is effectively a blood glucose meter or monitor, and that monitors my blood sugars. It's not as reliable as the blood test meter because it tests a different type of fluid, doesn't test blood. It tests like fluid within the skin, but it does give you like a very good understanding. It's just like 10 minutes behind what the blood would be. So I am still using the blood test monitor, of course, but it's really handy to have it. So it's called the Freestyle Libra, comes with an app that you can use, and effectively you hold your phone up like if you were doing contactless when it works, and you just scan your arm and then it comes up with the blood reading now. I don't know how well you can see it. Currently 3.7, going low. But I will obviously double check with the blood tester in just a sec. I won't do it on camera because I know some people are afraid of needles and blood, etc. So I will do it in just a second. But yeah, that is how I've been coping the last couple of weeks or so. I've been trying to adjust my diet. So when it comes to like treatment options and things then, at the moment I'm watching what I eat. I am trying to eat low carb meals. I'm trying to make better choices when it comes to food, to try and manage it diet controlled, because you can manage it diet controlled. Potentially, if the midwives think I need to, then I will be moved on to some medication. There is a medication called metformin, which is a tablet that you can take to sort of manage your insulin levels, etc. But apparently it comes with really, really harsh symptoms with the stomach. So sometimes they tend to move you straight onto insulin injections, which really, really scares me because I hate needles anyway. But like I say, my partner being a type 1 diabetic, I have a pro here that can actually help me with that. The more thing I was upset about is like it's another thing now that's affecting potentially my labour and my birth. I obviously had a very, very difficult birth with George, and I wanted this to be like my positive experience of birth. I found out that I was GBS positive again, so that kind of knocked me back a bit because from the offset you do really have to be in hospital to have antibiotics, and now with obviously having this, there is a real high chance that they are going to offer me a section early if he keeps growing the rate he does, and obviously the amount of insulin that his body is producing, they kind of want to be monitoring him outside of my body. So I have a consultant appointment next week. Obviously I will discuss with him all the options and he'll decide what's going to be best for me going forward from here. But yeah, you know, I just want what's best for me and baby at the end of the day. So I'm kind of trying to just take the positives from everything. And as long as I am healthy, as long as baby is healthy when we're both here, really, that's all that matters. So from here then, like I say, I'm just going to keep monitoring my diet, keep drinking lots of water, trying to increase my exercise a little bit. I've just started maternity leave this week, so I'm intending on going swimming and also just taking some walks around the block after meals. She said that's that's a good way to keep your blood sugars down after eating, is maybe go for a walk. Instead of like eating cakes and sweets when I have got low blood sugar, I've got these lovely glucotabs, which are a raspberry flavour, and I actually think they're really tasty. So I don't mind, well, going low isn't great, but if I do, it's not like I'm having to have like a horrible medicine. I can have one of those, that they're really nice. But yeah, apart from that, that's, you know, there are risks that come with it. I don't really want to think about the risks because, you know, they're really, really rare, but I am someone that panics a lot anyway, so I kind of don't want to be thinking about the risks of gestational diabetes. It's going to be positive. I'm going to stick to having a healthy diet, and the pregnancy is almost over. And as I'm sad to say, because this is my last baby, I just kind of want to have him now and him to be here so I can look after him and know that he's safe, because the pregnancy has been quite difficult and tiring, and yeah, I just want him here so I can look after him, really. But yeah, that is where I'm going to end today's video. I think it was actually a bit of a longer video. I thought it was just going to be like a couple of minutes long, but of course I've rambled, which I always do. So yeah, I'm going to end the video here. If you did enjoy the video, like I say, please give it a big thumbs up. I know it wasn't a cheery video, but I just love to see you guys interacting, so I know who is watching my videos. Leave a comment down below and just say hi, or, you know, explain your experiences. Like I say, I'll link those sites down below as well for gestational diabetes, so if you want to go and check those out, they may help you. So definitely go and have a look. And yeah, if you're not already subscribed, I'd really appreciate it if you subscribe to my channel. But thank you so much for watching. Have a lovely rest of your day and take care. Bye.